I wanted to have a talk to you today about vasectomy, which is a very common topic often discussed in local pubs and bars around Australia. It's interesting that about 1 in 4 Australian men have had a vasectomy, so it's very common. However, despite the commonality of this procedure, there is a lot of myths and misunderstandings about what a vasectomy is, how it's performed, and what the consequences are long term. I often have a wry smile when patients come in for the talk, so to speak, regarding the vasectomy. And often men recall horrendous stories that their mate has had following a procedure such as a vasectomy. Let me reassure you that a vasectomy is a very simple procedure which is performed under a twilight anaesthetic and local anaesthetic in my practice. And indeed it's done in a very painless fashion. There are a lot of myths regarding vasectomy. One is that it will affect your sexual function, it'll stop you ejaculating, it might have long-term effects on your health. Let's just address some of those misbeliefs now. It's a common misconception that the vasectomy might affect sexual urge and sexual function, but this is not true. The evidence is that in fact in some circumstances it even enhances sexual function because we don't have the risk of an unwanted pregnancy. But the evidence suggests that there is no influence whatsoever on this operation on your future sex life. Yeah, it's a misconception that when you have vasectomy that you will no longer ejaculate, but this is not true. About 98% of the ejaculate is actually made by the prostate and the seminal vesicle, and only about 2% of the ejaculate is the swimmers. So when you don't have the sperm in the ejaculate, you will not notice it because it's only about 2%. And that's one of the reasons why you have to do a sperm test to see that you have reduced the amount of sperm in your semen, because you will not notice it physically. So the testes will function normally after a vasectomy. The testes will still produce sperm and they'll still produce testosterone normally. Yeah, there's a common misconception that vasectomies are horrendously painful and they last for long periods of time with discomfort, and this is totally untrue. With modern anaesthetics, we can reduce the incidence of pain during and post-operation to a bare minimum, and indeed if you're in a sedentary job you could return to work after 1 or 2 days. If you're in a fairly physical job, then we say that you probably should not be doing physical exertion for 7 to 10 days. A common question is, when can I commence sex? It's recommended roughly about 7 days post vasectomy. Some people take longer depending on how much discomfort and pain they have post operation, but on average it's roughly 7 to 10 days post operation that you can recommence sexual activity. The failure rate for vasectomy, if performed correctly and if the patient follows the post operative sperm analysis appropriately, the risk of failure is about 1 in 2,000. It's thought that in that group the tubes that are tied can reconnect. It's very rare. In the 20 years that I've been doing this procedure, we have had not a case. Yes, there's often horror stories that mates like to talk about and brag about in the pub after vasectomies, but in reality most vasectomies go very smoothly and with minimal pain. However, if you do not follow your post-operative instructions, you may cause some significant bruising or bleeding, and of course this would cause pain. The commonest reason why men return and ask for a reversal of vasectomy is sadly a breakup in a relationship, and the male meets a younger lady who wishes to have children. Yes, a vasectomy can be reversed. However, the success rate of the reversal really depends on the type of procedure that was done, but also more importantly the length of time between when the vasectomy was done and when the reversal is performed. If you choose to have a reversal within 5 years of the vasectomy, the success rate is in the order of about 75%. If you choose to have a reversal between 5 and 10 years after vasectomy, the reversal rate is probably around about 50 to 55%, and greater than 10 years it drops down to about 10%. Often I've been asked what my experience is in counselling and performing vasectomies. I've been doing this procedure for approximately 20 years and have done about 2,000 vasectomies in that time. Most patients do exceptionally well, particularly if they follow instructions, and we have had no failure rates to date.